Welcome back to PhysioFeed. Today we are diving into a topic that might explain some of those mysterious aches and pains you have been experiencing. Referred pain. Have you ever felt pain in one part of your body but the actual problem was somewhere else entirely? That's what we call referred pain, and it's more common than you might think. Before proceeding further, let's review these two terms, pain and nociception. Pain is an unpleasant sensory and emotional experience associated with potential tissue damage. Nociception is the neural process of encoding and processing noxious stimuli. It refers to the detection of tissue damage or injury by specialized sensory receptors called nociceptors, which are located throughout the body, particularly in the skin, muscles, joints, and some internal organs. So, just because the pattern of pain does not fit a recognized diagnosis, to conclude that the pain does not exist is an absurd idea. Common patterns of referred pain are radicular referred pain and somatic referred pain. It is associated with nerve root compression or irritation and has a characteristic quality of sharp and shooting pain. The patient presents with paresthesia corresponding to a dermatomal distribution and muscle weakness. It is a type of pain that originates in one part of the body but is perceived in another area. This phenomena occurs due to the way nerves and tissues are interconnected. When the transmission of the nociceptive signals between nerves and tissue is disrupted, particularly within the central nervous system, it can lead to altered pain experiences. This disruption can occur at various levels of the pain pathway, including the dorsal horn of the spinal cord, the thalamus, and other brain regions. These alterations are often associated with chronic pain conditions. Features of pain that suggest it is more likely to be referred include a dull aching nature, poorly localized, deep-seated, movement from point to point, less local tenderness, long-standing pain, and a failure to respond to local treatment. What contributes to somatic referred pain? Two important factors are myofascial trigger points and joints. It is a hyperirritable spot in a taut band of muscles present focally. Trigger point can be active or latent. Active trigger point is associated with pain at rest, and if stimulated, it produces a local twitch response in the affected muscle. Three key features are listed in the table. Somatic pain originates from the joints such as knee, hip, shoulder, or spine. The hamstring and buttock pain can be associated with nociceptive input from the annulus fibrosus of the intervertebral disc of the epiphyseal joint. Pain around the shoulder may be associated with nociceptive input from the structures in the cervical spine.